You just trust it, right? That they're giving you the right thing and the right amount?
Yeah.
Okay. So we're going to talk about how we give medicine safely, okay? Because people trust nurses to give them the medicine. They think that it's the right amount, okay? So we're going to talk about safely giving medicine, okay? So we're going to, I'm going to show you a little video here I want you to watch.
It was November 2007, less than 2 weeks after Dennis Quaid's twins were born, when the actor says the nurse caring for them nearly killed them. The babies, Thomas Boone and Zoe Grace, had been readmitted to Cedars-Sinai Hospital in Los Angeles for a staph infection, but the nurse unknowingly gave the twins 1,000 times the recommended dose of the drug heparin, a blood thinner. Quaid and his wife were in the room but didn't know anything was wrong until the next day, when they found their newborn twins bleeding profusely.
Their now water-thin blood had the real possibility of hemorrhaging through a vein or artery, causing massive brain damage or failure to one of their vital organs.
Quaid says the twins were supposed to receive 10 units of heparin, but instead got the adult dosage of 10,000 units, a massive overdose that turned their blood thin as water. How could this happen? Quaid says both the pediatric dose and the adult dose of heparin have similar labels. For the next 41 hours, doctors scrambled to save his children.
At one point, as the doctors tried to clamp a bleeding wound in the remnant of T. Boone's umbilical cord, blood spurted 6 feet across the room and splattered on the wall.
It was the most frightening night of his life. They'd worked so hard to have children. First, trouble conceiving, then miscarriages, and now this.
Our babies could have died that night.
3 other babies did die in Indianapolis a year before. Just like the Quaids, the 6 infants in that case were given adult doses of heparin. Half of them died.
They recalled automobiles, they recalled toasters, they even recalled dog food. But Baxter failed to recall a medication that, due to its labeling, had already killed 3 infants.
Baxter International, one heparin manufacturer, told CNN it had redesigned the drug's vial before the Quaid scare to help doctors identify the right dosage. But Baxter did not recall the older vials, so they were still being used at Cedars-Sinai, where Quaid's children were treated. Quaid sued Baxter for negligence, but the case was dismissed. Quaid and his wife reportedly settled with Cedars-Sinai Hospital for $750,000. But they say this isn't about the money. This is about protecting patients and doing something about the nearly 200,000 Americans who reportedly die each year due to medical errors. Randy Kay, CNN, New York.
Okay, so that's kind of scary, right? Medication errors, a mistake in giving medicine, it causes at least 1 death every day, okay? Approximately 1.3 million people are hurt or injured every year in the United States. And so it's very important for nurses to be able to look at medications and give them safely to our patients. So today we're going to talk about the parts of a medication order. We're going to talk about 6 rights. Okay, y'all are going to have to learn that for a little quiz. 6 rights of medication administration. Okay? And then we're going to give medicines to our patients here. Okay? All right. So, why do we need medication?
To make us feel better.
To make us feel better. Okay? To heal us. And so, all throughout history, even back in the caveman days, okay, in the Bible, in history books, we see how people use different things to try to heal people. They used oil, they used wine, they used plants, okay, and they use these to help somebody feel better, okay. I know Miss Garza talked to you about Florence Nightingale, right? Before Florence Nightingale, there were no nurses, right? She was the pioneer nurse, right? And she was the So, there are different types of medications, okay? Who can name one type, one form? Yes. Okay, that's a specific medication. How would you take it? What form is it in? A pill. How else? A liquid, okay? So we have pills, we have liquids, those are called oral medications, okay? Then we have something called parenteral medications. Those are things that are injected. So where would you get an injection? In the arm, like insulin, or else?
Your blood.
Yes, okay. And so, in your thighs, babies get them right here because that's their biggest muscle, okay? You can also get a medicine through the vein, right? If somebody puts an IV in, you can get it through the vein, okay? There's something called transdermal. What is dermal? Skin. So transdermal means that it goes and it gets absorbed through the skin. So there's like little patches that we can put on and that medicine goes through the skin. There's also rectal medicine, right? Babies, they get suppositories because they can't swallow pills. Maybe they'll spit out medicine, and so we have to put it in a different way, okay? So there's different forms of medication. So who administers medication in the hospital? Nurses. Anybody know who else might give a medication? A doctor. Huh? Okay, parents, if it's a child, maybe they'll help, okay? But respiratory therapists also give medications. They give breathing treatments. Have y'all ever had a breathing treatment? Yeah, we didn't talk about that kind of medicine. That one you inhale, okay? Anybody have asthma? No, you know somebody that has asthma, you take it, a pump, right, an inhaler. And so that's another type of medicine, okay? So how does a nurse know what kind of medication to give? Okay. So does a nurse just think, oh, I think he needs this medicine? No, just give it. The doctor says, the doctor has to write an order for medicine, okay? So we're gonna talk about the parts of an order, okay? There are certain things that the doctor has to order, okay? 4 main components, okay? So the first thing is obviously the name of the medication, okay? So somebody said Tylenol earlier, all right? And so that's our example, Tylenol. Then we have to have the dose. What does that mean? The amount of medication. So in this case, what's in red? 500 milligrams, okay? And then we have the route. What is the route word?
Like where it's gonna go.
Where it's gonna go, okay? How it's gonna be given. PO is a medical abbreviation that means oral, okay? So PO means oral. That means you're gonna take it through the mouth, okay? And then the 4th part of the order is our frequency. What does frequency mean? How often you get it, and how often does this patient ever get it? Every 4 hours. So the whole medication is going to be Tylenol, 500 milligrams, PO, every 4 hours. Okay, so how many components are there? 4 components to a medication order. So how can the nurse know that the medication is safe for the patient? What you saw the video, right? The nurse should have checked the label to make sure that she was giving a safe dose, but she didn't, okay? She didn't read the label correctly. And so there are things that we can use to make sure that we are giving medication safely. And so everybody has a book there on their desk, right? What is it? A drug handbook. And y'all flip through it. What does it tell you in there? Information about the medicine. So it tells you the different types of medicines, how it can be given, okay? Because we talked about Tylenol, right? It can be given different ways, through a pill, through a liquid that we drink, or even rectally, okay? And so we can get it in different routes. It'll also tell you the safe doses, okay? A baby can't take the same dose as an adult can, right? Because it'll hurt them. And so it'll tell us the safe doses. Side effects. What is a side effect?
Like what happens when you take it.
What could happen when you take it, okay? Like, there's certain medications that would make somebody bleed a lot more, okay? And so those are side effects. Maybe it will make your stomach upset. How many of you have taken medicine and it just makes you like, okay? And so that's a side effect. And in your drug book, you'll also see something called nursing implications. That means things that a nurse has to do before we give the medicine. So if somebody is getting Tylenol because they say, you know what, I feel hot, what do you think a nurse has to do before we give it? Good, take the temperature of that patient. That would be considered a nursing implication, okay? Sometimes we have to look at the labs, okay? From our blood, we have to look at the amount of electrolytes or minerals that are in the blood before we can give it, okay? And then we have contraindications. Does anybody know what that word is? Contraindications, that means something that would prevent somebody from getting that medicine, okay? So let's say, remember I told you that there's a medicine that could make somebody bleed a little bit? If they already have a bleeding disorder, that medicine would be contraindicated. That means they couldn't get it because it would hurt them even more, okay? Okay, so I want you to real quick find acetaminophen, that's Tylenol. Page 73, good. So let's turn to page 73. Are you on page 73?
Yeah.
Okay. All right. So give me a side effect. Okay, look for the side effect. It might say adverse effect. Agitation. Okay. That's on the next page. Huh? Anxiety. Hypertension, insomnia, fatigue, jaundice. So again, what is a side effect? Something that what? Something that could happen after we take the medicine. Now, do we take Tylenol so that we can be agitated? No. No. Do we take it so we can have insomnia? We can't sleep? No. But those are side effects, things that we really don't want to happen, but they could. Okay? So that's a side effect. Can you tell me one nursing implication?
Is that nursing consideration?
Yes, nursing considerations.
Don't exceed 5 doses in 24 hours.
Don't exceed 5 doses in 24 hours. You know what could happen? It could hurt the liver. Okay? So it's very important for us to know what our implications are as a nurse. Okay? Things that we have to look out for. What's another one?
Reducing total daily dose and increasing dosing.
Okay, so we might, with what?
I don't know what that says. With intervals. No, here.
Hepatic.
Oh, yeah. And or renal impairment.
Okay, good. What I just said, if we take too much, it's gonna hurt our liver. So somebody that already has liver problems or kidney problems, we have to reduce the amount that they take, okay? Because it could really hurt them, all right? So good. In a little while, we're gonna, you've got a sheet, a little form. And so I'm gonna give you the name of a medication and you're gonna fill it out, okay? Looking it up in your drug handbook, all right? So we'll do that after we go through the lecture, okay? All right, so I mentioned that there are 6 rights, okay? We call this the 6 rights of medication administration, okay? The first one is the right patient. When we give medicine, we have to make sure it's the right person, right? I don't wanna give Muhammad, a medicine that is, your name? VNA, okay, see, I gotta remember these things. So I don't wanna give Muhammad a medicine that the doctor prescribed for VNA, right? I don't wanna do that because it might hurt him, all right? And so I have to make sure it's the right patient. And so the way I do that is I go and I ask the patient to tell me their name, okay? So I don't wanna say, hi, Miss Garza, can you give me your name? Why would I do that? I already told her what her name is. What if she's confused and she's saying, well, Miss Garza?